The health minister started off by saying that he had planned to issue a statement tomorrow, but due to circumstances that had to change his, his diary for the day, he decided to then call this urgent press briefing. And he says that it was actually a statement from the DA's Jack Bloom that said that there was an Ebola suspected case at Rahima Musa Hospital, and we know that that's the mother and child hospital that's in Gauteng. And he says that that statement then sent, quite a lot of people into a frenzy, and got so many phone calls from the media asking, are we in danger? Has it spread to South Africa? What's happening? And he says that then he felt that he should just come and give clarity as to what has been going on. And he says that South Africa is not, it has not spread to this part of the country. That particular woman had actually flown in from Guinea on the 28th of July, and they screened her. And he says that it was the second screening because the World Health Organization actually sets up these screenings before they leave their countries. And so he says that then the woman reappeared at Rahima Musa to give birth because she's currently in labor. And then it was then where she informed the nurses that she now has a fever. Then they decided to isolate her and run several tests. And based on the fact that she comes from Guinea, which is one of the countries that have been affected, she was then tested, and vigorous testing processes were actually done on her. And he says that then the test results have actually proven negative. And so this woman does not have Ebola. She's only in hospital to give labor because we understand that she has not yet given birth.
At any point, was it a suspected case of Ebola, or did the Democratic Alliance's Jack Bloom simply jump the gun on this one?
The minister says that when this woman was actually screened, Jeremy, when she actually first came, when she was first screened at the airport, there was just, no signs, there was nothing. And then when she went to the hospital, she reported that she had this fever, and then that's when they decided to actually just isolate her because she comes from a country that has been affected. And he says that they had actually agreed because in a meeting they held last week, and he says that the EFF was there, the DA was also there. It was agreed that statements were actually going to filter through from national office and not from the provincial offices because they did not want to cause panic. And he says that he's actually surprised that Jack Bloom actually jumped the gun and sent the statement because the minister himself had planned that the statement was actually going to go out tomorrow. All
right, so it was the initial report was unfounded. Having said that, though, was the minister asked about our capacity to handle an Ebola crisis or an Ebola outbreak should it so occur?
Well, the minister reminded us of a briefing he actually made to the portfolio committee on Tuesday, saying that we are equipped, and he says that there have been protective measures that have been taken. At Charlotte Maxege, for example, there would be about 200 personnel that would be waiting to touch any patient that is suspected to be an Ebola case. And he says that there's protective gear, there's gloves, there's gowns, there's everything that have been sent to different hospitals, and reminding us that there's about 11 hospitals around the country, hospitals which include Charlotte Maxege, which include Polokwane Hospital as well. And he says that those are the hospitals that have been said to, declared that they're going to be ready enough to deal with such cases should they arise. And he says we should not go into a state of panic. Everything is under control.
You deserve to know more.
eNCA.com